Hello, and welcome to today's webinar, Handle with Care, Special Pathogens Waste Management. I'm going to go through a few introductory slides. If you're not familiar with NETEC, we are a partnership for preparedness, so setting the gold standard for special pathogen preparedness and response across health systems in the US with the goals of driving best practices, closing knowledge gaps, and developing innovative resources like this. The NETEC network is made up of 13 regional treatment centers scattered across the United States, one in every HHS region, and the contacts are here for your local regional emerging special pathogens treatment center. NETEC offers a variety of services, including consultation and assessment, where we help facilities understand where they are in their road to preparedness, and have some online resources to help them gauge what that preparedness level is. And then we can do on-site assessments. We also do training and education through things like this and online courses. And there will be a link to this course about 3 to 5 days after this webinar, and the slides will be available as well. We also have a research network with a central IRB, so we can quickly accelerate the release of testing and medications when new pathogens emerge. And we have international partnerships, really trying to strengthen this worldwide reach because we all know that the pathogens have no borders. All right, so we're going to dive right in. And as I said, I'm so excited to introduce Alex Chapman and Kara Samaga, both from the Healthcare Waste Institute. And they're going to kick us off with just a tremendous amount of information about Category A waste. And then Caroline and Lana will come back on, and we are going to really sort of apply that, if you will, to our healthcare facilities and look at some sort of pragmatic, we hope, and specific information. So thanks, settle in, and take notes on healthcare waste and Category A. Thank you so much. I'm going to turn it over to Alex and Kara.
Thanks, Jill. So we're going to start off today with a quick review of the agencies that primarily regulate infectious waste. Requirements around infectious waste are designed to reduce risk and negative impacts to human health and the environment. You'll see a few agencies listed here that you're likely at least familiar with. The Occupational Safety and Health Administration, or OSHA, they were basically are designed to have a focus on regulated waste and bloodborne pathogen standard and focusing on employee safety. The Department of Transportation comes into play because infectious waste is a hazardous material, given that it can adversely affect health and the safety of the public and the environment. So the DOT regulates safe transport of hazardous materials in commerce, including infectious waste, to protect human and environmental health. A lot of regulations around infectious waste are found in non-federal requirements, like local, state, and tribal EPA equivalents, as well as departments of health, including the generation, the transport, treatment, and disposal. For the purposes of today's discussion, we're going to evaluate infectious waste by looking at Department of Transportation, or DOT, information. Next slide, please.
All right, so DOT regulates all materials that pose an unreasonable risk to health, safety, and property when they're transported in commerce. And they call these materials hazardous materials. And there's a table in the regulations that lists out what they consider to be hazardous materials, how to package them, how to properly identify them, how to communicate them to, or not communicate them, communicate their safety and the risks of them to others that might be driving next to that truck that's hauling it on the highway. So there's actually over 3,000 listings in this table. And most of these things, most of these hazardous materials have a chemical risks to them. So they're flammable, they're acidic or basic, corrosive, maybe they're even explosives, right? But there are things listed that pose a biological hazard in this table. And that's where we will see that there is a classification known as 6.2 infectious substances. Next slide, please.
Now, with infectious substances in class 6.2 that Kara just mentioned, there are 3 possible classification categories. There's Category A, Category B, and regulated medical waste.
Yep, and so kind of the easiest way to look at or kind of differentiate Category A and Category B is to think about, no one really wants to get sick ever, right? Like we lose work and time, we might miss vacation, bad. But in thinking about A versus B, you definitely don't want to be exposed to or contract an illness stemming from a category A infectious substance. These are things that when you hear their name, you've either never heard of it in your life, which is a lot of the time for me, or you shudder because you know that these infectious substances or pathogens have a really high potential for harm, permanent disability, or even death. Category B is the opposite of that. So most of the patients, those of you on the clinical side of things are treating, they have a disease that, isn't going to cause you harm, right? If you're exposed to them or working with them, maybe they are in there because they have, I don't know, really bad pneumonia or something like that, right? So, by you working with them, you're not getting exposed to that pathogen. I mean, you could be, but, if you were, it's not going to cause, death or so. Next slide. Okay, so the nuance of what category of pathogen that your patient has directly impacts how you manage the waste that is generated from their care. So I'm sure you're all familiar with the red bag in this picture, and you probably have a pretty good idea of what's supposed to go in it. And in focusing on DOT today, and in their term regulated medical waste, or RMW, as you'll probably hear Alex and I say a lot, that's one of our favorite, most used acronyms. So we're going to focus on what DOT thinks should go in the red bag. So regulated medical waste includes items known or reasonably expected to contain a pathogen because it was generated during the treatment that you gave to your patient, right? So for those of you, again, on the clinical side, I think there's a lot of you today, you guys know this, you make decisions every day on what goes in this bag or maybe a sharps container, as that is a type of RMW as well. And you've likely even seen some of the information that UN 3291, which we're not going to get into what that means today. That's another long webinar potentially. But regulated medical waste 6.2. We've already seen that on our prior slides, right? Because that stuff's on your containers, your labels. It's on shipping papers that you might sign from your vendor. Because again, that's the entry in the hazardous materials table we talked about that describes this waste that we're shipping. But what I want to call attention to on this slide is the bullet that says, if the waste contains or is contaminated with a category A infectious substance, it may not be shipped as regulated medical waste, meaning you can't just put that in the red bag or any old sharps container. There's probably going to be some additional requirements for packaging and handling and things like that. So next slide, please. So as Alex stated in our opening slide, there's multiple agencies involved to help you determine what should go in a red bag, sharps container, or whatnot. That might be OSHA. That might also be your states. We find that a lot in the medical waste industry. State regs, they often use different terms, different identifiers to explain what is not medical waste. They may also spell out additional categories such as sharps, which is pretty much always mentioned, or maybe things like pathological waste, which oftentimes requires additional handling and management. Some states require incineration of that, for example. But when you look at all of these regs, how do you know what requirements you have to adhere to? Well, you always have to look at the requirements that are most stringent. And when it comes to special pathogen waste, particularly category A waste, you cannot just put that waste again in your typical red bag or sharps containers. You have to know potentially if it's category A.
So Kara, category A, you've established for us that it's an infectious substance and hazardous material, obviously is a higher risk associated. So if I have no pre-existing conditions and I'm exposed to category A, then I'm likely going to have a severe, permanently disabling, or even might experience death. So pretty severe stuff here. How are generators and transporters able to identify which wastes are category A?
Great question. If you can go to the next slide too. Thank you. Okay. So I'm sure that, like myself, most of you don't have a running list in your head of like what pathogens are the most life-threatening, deadly, or maybe our amazing co-presenters do, like Jill, because she lives this, I think, every day. But most of us are going to need somewhere to go to find that information. And thankfully, such a place exists in a document called Managing Solid Waste Contaminated with a Category A Infectious Substance. And there's a link on this slide, and I think that's going to be supplied after as well. And you'll notice it's housed on a DOT website because they helped write it. but many other agencies were involved as well. So you'll also hear Alex and I talk about this as the interagency guidance. Because again, like CDC, EPA, OSHA, other agencies that I'm forgetting, because there were a lot of people that worked on this and were very heavily involved. Excuse me. So basically, if you see a pathogen listed in Appendix B of this document, it most likely is category A, and we're going to show you a picture of that coming up. When you've generated waste from testing or care of that patient, you can't call it regulated medical waste or use that 3291 that I mentioned earlier. Instead, you've got to classify it as one of the items listed here. But for the sake of simplicity, we're just going to call it RMW plus. You're going to hear me say that a lot instead of mentioning UN 2814 or UN 3549. I think RMW plus is a good way to think about it because the packaging and handling will be very similar at its core, but because of the nature of that pathogen or the waste being more dangerous than what you typically deal with on a day-to-day basis, more is going to need to be done before it can be moved around your facility, shipped, or disposed. So next slide, please. So this is going to show you a snippet of that Appendix B that I just mentioned. And you'll see in this column that says Category A substances, UN 2814. And then you'll see there's another column for pathogens or agents, as they're calling them in this document. And those will be listed in alphabetical order. So in this example, we see a checkbox for Nipah virus, and I might not even be saying that right, so bear with me, but I'm going with Nipah. And you'll see in the Category A substances 2814 column, there's a checkbox. This means that the waste generated from the care of a Nipah virus patient is going to require special management and handling. And think about, again, that RMW plus term that I used earlier. The waste generated from the care of that patient is going to need that special handling. And so is the patient too, right? Quite frankly. But if you look before Nipah, you'll see Mycobacterium tuberculosis, which also has a checkbox in the same column for category A as Nipah. Now you might be first thinking, oh no, I've never done anything different with waste from a TB patient. We don't treat them in a special pathogens unit and things like that. Well, the good news is because you see that C/O in that column, that indicates that it's only cultures and specimens that were, intentionally propagated need to be managed as category A. So thus, if you have a TB patient, the RMW and the sharps that you are generating from their care, their day-to-day care, can be managed as you normally would in a red bag or sharps container. But if you're in a lab that cultured that TB, and I'm not talking about just you have a blood sample with it in it, like you grew it on a plate, right? So I'm talking about a live specimen. That's what would need to be captured as category A or RMW plus, as I like to call it here too today.
Now, the interagency guidance document has a lot of additional resources and information within it. If you haven't had a chance to look at it, I recommend you do. There's a lot of great stuff. As you can see on this slide, for example, when you look at some of the agents that are listed, for example, the monkeypox virus clade 1, there's a hyperlink. You will click on that and that will bring you to an appendix with additional information. And with this specific example, you'll see that it not only includes some of the general information about the classification, but if there's a DOT special permit issued, and we'll talk a little bit more about that shortly, packaging requirements, shipping names, inactivation methods, as well as disinfectants that may need to be used.
Yeah, I think this monkeypox example from the document is really good to share because it also shows how much this document has been updated and expanded even very recently. So for example, when those of us kind of on the non-clinical side, us waste folks, when we first heard about monkeypox and when we looked at that Appendix B list, we were like, uh-oh, there's a checkbox there. It didn't say cultures only at the time. So there was a little bit of panic and concern as we heard that was going to be something that was becoming a little more prevalent in the United States. But eventually, science and information evolved. And now we have, we still have the check, but it's, again, the cultures only indication in that category A column. And even so, it's only viral cultures of clade 1. So we were off the hook and we didn't have to all the patient care waste from those with, the different clades of monkeypox as category A. So So it's just a good example of how the interagency document can grow and evolve. So always use that link when you want to reference it. Do not download it on your computer because it can change rather quickly with great updated information. So we've learned about, this list that exists, that Appendix B that I just showed you, that tells you what is Category A and, how that ties into the management and shipping of waste from a DOT perspective. But again, what about the states? Do they say anything specific on Category A or RMW plus, as I'm calling it? Well, most do not, because people really only started talking about all of this, Category A and whatnot, back in 2014, and mainly because of Ebola. So that was, 10 years ago already? Wow. So the RMW rules have been around, though, since the early 90s. Thus, a lot of the state regulations, and the state regulations haven't changed a lot. So they just didn't really discuss Category A or special pathogen waste, which is thus why we are so focused on the DOT regulations today. And then just because your state doesn't call it out, like the couple of states I have listed here, again, if this waste is getting transported on the highway, looking at the DOT regulations is the first and best place to look for any information on Category A management. So again, in looking at those DOT requirements, let's start talking about how to plan or manage for Category A waste. So first, the packaging requirements for Category A waste are going to be more stringent than most things in the DOT regs. So much so that they actually aren't going to even be found in those regulations, but in something called a special permit, which we're going to talk a little bit more about shortly. We received a question during registration actually that asked, how do you ensure that the entities that are going to ultimately transport and dispose of the waste, really know what they're getting into? So Alex, I'll let you take that one.
Sure. So I think the first place to start is making sure you understand what the requirements are yourself and that your supplier is familiar and understands them as well. So we'd start with referring to the interagency guidance document and then the resources referenced therein before that outline the types of waste. We also need to make sure that there's clarity on the types of regulatory requirements. As Kara mentioned, only a handful of states have state requirements, and we need to look at federal as well as follow other agency guidance. It's also important to make sure that you understand your supplier requirements and that they are permitted. So first and foremost, Kara mentioned, we mentioned the special permit. They need to have a special permit in most instances. And then they also may or may not be able to manage the waste themselves, may need to work with third parties. There might be specific container requirements, which we'll talk a little bit about as well.
Yeah, but I would also add, that most suppliers, like most of you have somebody that's managing your medical waste, might even be the company Alex and I work for, whatever. But you can't just assume, oh yeah, they're going to take it and it'll be fine. We just have to do a few extra things and all will be good. Unfortunately, that may not work that way because this is such a complex waste stream. And it's so important then to coordinate with all parties, as soon as possible, right? Even before you think something is going to be coming to the United States, a patient or, whatnot. So coordinating and understanding the management requirements that, again, often go beyond regulation. So those suppliers are going to have different, and we're going to talk about this more, suppliers are going to have different management and, handling requirements too. But one more hurdle I want to talk about just briefly, because I don't think we talk about it the rest of this presentation. Another hurdle you may need to overcome is going to be the media. This could cause, you to change your plan on what vendor you use or where that vendor takes the waste. I mean, the state could get wind of this and say, oh, we watched a special on CNN and, oh, I don't want any trucks coming in my state with this waste stream. So we did encounter some of that during Ebola. So really important to think about, once the news gets out of one of these pathogens being out there, the media may take hold and really kind of make it a lot harder to manage. So next slide, please.
There's a lot of things to consider when you're trying to support successful outcomes, whether you are a healthcare organization or an organization such as a supplier supporting a hospital or other medical organization. So there are a few things that we'd recommend. First, you need to have an open communication between both sides to ensure that there are clear objectives, which can be done if you have all of the appropriate internal and external stakeholders involved. typically, really with any waste program, if you don't have the appropriate people at the table, there's going to be a gap. And especially when we're talking about something as significant as category A waste, we want to make sure we have everyone involved that needs to be. So both generators and suppliers need to be proactive also in sharing their requirements and needs to safely and compliantly manage their waste. Everyone involved in support of managing the waste has to follow requirements. And when we say that there are requirements, I think the first thing everyone thinks about is like, oh, I've got regulations to follow. Absolutely. But that's just one of the requirement areas that we need to keep in mind. There's a framework of requirements that need to be followed and that extend beyond regulation. And let's refer that as the operating framework, the framework that you need to operate within to ensure compliant and safe management. And that can be defined as requirements that are applicable to regulation or other rules. The second is industry guidelines or standards. The third is your organization and your community. So you have your own organizational policies, and then the suppliers or partners that you work with will have their own requirements. And each are important because even from a supplier standpoint, there may be requirements that they are beholden to that as a generator you would not be. So when we think about this, proactively identifying the requirements applicable to your organization and including them into your business planning are going to help create efficiencies and reduce risk. And having designated responsibilities by role function is essential to ensure a solid operating plan. You need to have clear expectations by role, and then ownership, navigation, design, and execution will also reduce risk in really any program.
Yeah, and when she says any program, I know we're here talking about category A, special pathogen waste and whatnot, but really what she just described is applicable to all waste, right? Like you should always have some type of plan in place for all of the waste you manage, be it the regulated medical waste we've been talking about today, your chemical waste or hazardous waste from the lab, even your recycling and solid waste and things like that. So this is all a good idea, not just for category A, but for all of the waste management that you do at your facilities.
So I do want to call out when we think about stakeholders, we might think just decision makers, or we might just think stakeholders in my own organization. It's really important to consider both sides, internal and external, whether you're a supplier or a healthcare organization, as well as your frontline stakeholders and what we'll call compliance function. So I just want to talk through that briefly to clarify. And really the compliance function, we want to think about that as those are the people that have ownership of the rules in the organization. This could be your senior leaders, safety, risk, accreditation, purchasing, and infection control and epidemiology. These people are your subject matter experts and should be able to articulate the requirements and provide expertise. They should be able to translate the requirements and apply them through a lens that's applicable to the program that you're trying to stand up. And that will be shown and done through procedures, practices and processes, and education that are done for your staff. These folks will be essential to support positive change management and can significantly impact your culture around whatever initiative you're focused on, in this case, category A. Now, the frontline team members are important as well because they are going to be the ones that use the information and the rules and action in their day-to-day work. And the rules will have been embedded into their processes, and they will need to follow them in their day-to-day responsibilities that will impact decisions with purchasing, use, disposal, and managing waste. They are essential as you're putting together your policies and processes because they're going to be able to give insight into specific workflows and functions that could have an impact on the things that the compliance function would need to manage. After determining your appropriate stakeholders and clarifying the requirements, you'll be able to better understand the resources that are needed. With category A waste, there are many requirements. So for the purposes of this presentation, we're just going to cover high level some of the resource considerations for handling and treatment of category A waste.
Yep, and I'm not going to go through all of these, just kind of quickly high level because we still have a lot to cover and I'm being mindful of time. But just in general, thinking about things on your site. Do you have the right PPE? Do you have the right spill kits? And are all those things placed in appropriate areas? Have you thought about the potential for a patient having this, whatever pathogen it may be? So a patient under investigation, PUI, excuse me. So, are you going to do something with that waste and kind of hold it while you're thinking about or finding out rather if they do indeed have that illness? Handling of waste. You want to think about, where things are in your facility. Layout is important because you don't want this waste to be, trucked around, 5 hallways and down 12 steps. And, you don't want it to be in areas where, patients are going to be around, or, the public. You want to try to, move these things around your facility, kind of in the background, right? Just like you probably do for most of your waste, but especially for this type of waste. So, thinking about where it's going to go, where it's ultimately going to be potentially loaded and unloaded somewhere, where you might have to do decon and things like that. So.
Kara, there was a question that was submitted from one of the attendees, and it was, is it actually safe to use offsite waste management services where my staff have to sort the waste and or package the waste? Is onsite safer? Is offsite safer? What kind of feedback can we provide there?
Yeah, I think you have to think about the same things. Both of them have potentials to be unsafe if you're not, prepared and following some of the advice and guidance that's out there. Because again, people are ultimately handling this once it leaves your clinical care area. It may be people at your facility, your environmental services staff and whatnot, or safety, or it may be, people at our facilities, our drivers, our plant workers once it gets there. So there's really one is not safer or better than the other, but just you have to consider, all the things that go and tie into those treatment processes. Next slide.
So in order to be able to clearly articulate the resources that you need, I'm going to really harp on this. Stakeholder engagement, having the right people involved is essential. When we talk about resources, it's not just materials. As Kara talked about, thinking about where I should be transferring the waste, where I would store waste for patients under investigation, who's going to do that, the materials, and then obviously costs associated. Those will be dictated based off of guidance from the stakeholder involvement. And then having open communication between internal and external stakeholders will be key.
Yeah, and again, I kind of hit on this prior. Thinking about, those that are going to be handling your waste next. So again, it might be people in your own facility. It might be those of us in the waste industry, our drivers and workers. Doing things properly and correctly from the get-go protects everyone all down that line. But also, again, remember, this truck, if it is leaving your facility, is driving on, the highways where you and I and our friends and families are driving to go to work or, go on vacation or whatever. So, if things are not packaged properly and appropriately, there is risk even to the environment and the public if that is not done. So it's just important to communicate all this information, make sure everyone understands so there are no gaps. Next slide.
If there's a gap in any of these areas, really, there's going to be a number of potential impacts that could occur, such as misalignment with policies or missegregation of waste. Then there becomes risk to patient and employee safety in your care of delivery, even unintentional vectors. We won't go through all of these, but there are pretty significant impacts if there are any gaps in that process.
Yep. So again, just kind of to recap some things to consider. We've talked about this a lot, engaging all of your key stakeholders. So be it from, key decision makers at your facility to frontline staff, making sure everyone knows what their role is in management of this waste. And then the next, understanding all the requirements that you might have from a regulatory perspective, but also in all that planning that you've hopefully done in order to prepare for this. So what is going to be in the patient room? How is that going to be set up? What waste cans are going to be there? Things like that.
And then from a communication standpoint, obviously policies will be there, but you also need various modalities to engage all staff and external stakeholders with role appropriate messaging and information. And you want to make sure that you're coordinating not just with your supplier and the healthcare providers, but also EMS, offsite ambulances, labs and diagnostic centers, anyone that could possibly be engaged or involved in management of this waste. Additionally, practice, training, doing trails, mock tracers, making sure that you have appropriate documentation in place, and you learn where you might maybe have an issue as you're practicing. Where was that gap? And then going back and working through and reassessing it. So Kara, one of the questions that was submitted was that about choosing a partner. Would you talk to us about the types of things that are helpful to consider?
Sure. A couple things. Making sure that you're both aligned on, first of all, like what needs to be done. Is your partner coming on site to help manage the waste? Or are they going to take it off site? Who are all the stakeholders? Again, both at that waste management company, if you're using offsite management, and also internal stakeholders. looking at all requirements, as we've discussed a lot here, I think already. What resources are needed? Is there something like, are you short on storage area and you're going to depend on perhaps your supplier bringing you a truck or a trailer or something to store the waste in? And another thing to look at too is just to really make sure that that partner, that they are clear in what waste you are giving them. So, with category A waste, there could be things that are hazardous waste in there, chemical waste that kind of are mixed in with that medical waste. So again, you just want to make sure that whatever you're giving them will meet up with their waste acceptance policies. Next slide. I will quickly talk about what a waste acceptance policy is. Most waste companies have these. They're based on regulation, but also could be permit requirements, safety requirements, and business decisions that company has made. So most have them for the different types of waste that they manage. So make sure you ask about that too. And then just real quick, want to look at kind of a recap of things to look at when considering your supplier. Are they willing to accept? Looking at those waste acceptance policies, are they able to accept it, permitted to haul it, treat it, whatnot? Are they able to provide you the supplies that you need per that special permit, or anything else you may need? And finally, can they perhaps supply you with storage for that waste? Because I'm sure you may not have the room, and sometimes it takes a while for this stuff to get picked up as well. And Alex, I'll let you take the last.
Sure. So one thing that has come up, not just with category A, but even with the COVID pandemic, was questions around, well, who provides PPE for my suppliers that might be in my building doing different work? Those are conversations that we really recommend that you have proactively, and clarify potential vectors and how to reduce those risks. Like if your supplier is bringing in their own PPE, how are they transporting that in? And make sure that there's alignment between your policies. Next slide, please. With regard to healthcare considerations, there's a few that we'll go over here quickly. So firstly, making sure again that there's clear communication on the requirement variances between RMW and category A with healthcare organizations, and clarity on permitting requirements. There should be resource share, there should be transparency in that, and use of the interagency guidance document that we've talked about. Obviously, NETEC is a fabulous resource that should be utilized as well. There's a ton of great information there. And then again, the open communication between all relevant stakeholders. And if you are treating waste on site, clarify how medical waste will be delineated from category A waste. So as you're collecting waste from different parts of your hospital or organization, what are the pathways that are going to be taken? How are you going to keep it separate? How are you going to educate your staff and communicate? Kara, I think you're going to take us through the last two.
I mean, I can't stress education enough. Training is so important. And a lot of times your vendor may even be able to help you with that. A lot of us have training materials kind of prepared for this already that you can use to kind of tailor to your facility needs. Same with on-site protocols. I can't read apparently. Happy Friday. But on-site protocols, just make sure everybody understands these, not just your team members at your facility, but if suppliers are coming on site to help manage this waste, make sure they know, like, all right, when I pull up the truck to this dock, that's when I have to put on this specific PPE or something like that for that as an example. So just make sure everybody knows what's going on.
So we've covered a ton of information and we're going to apply it to an example. Let's say that a patient has Ebola or Marburg and they're admitted to your facility. Is everything that is in that room, anything that is in space where their waste may be, for example, category A? And I'm talking not just the disposable items that are listed on the slide here, like linen or curtains, mattresses, dietary service products, oxygen cylinders. Kara, where would you start?
So I would start with a couple of things. So, I mean, we've had people call us and be like, oh my gosh, after one of these types of patients have been in the room, like, I've got to rip out the drywall and everything's waste, right? Well, not exactly, right? So especially if you planned well enough in advance for that not to happen. But so there is guidance in this, there is guidance on this slide from CDC that kind of complements that interagency guidance that we've been talking about. And it talks about things like, using disposable materials, how to clean things that aren't disposable. So like, an oxygen cylinder, for example, like you definitely don't want to put that in the red bag to go in an autoclave, which then becomes a bomb. That is not a good thing. So, but you can safe way to do that, in your proper PPE with certain disinfectant, whatever. So think about the things that you have to throw away versus the things that you can manage still on site, or again, not even bring in the darn room in the first place. So that's always a good thing.
So when we talk about interacting with suppliers, we're not just talking about waste suppliers, by the way. We're talking about any supplier. So for example, where you've got back and forth of materials, that could be linen as an example. What is their policy on management of linen? If in a normal situation where a patient might be admitted for a routine procedure, that linen is going to be sent out and come back. It'll be clean and come back. When you have a patient with category A waste, maybe not. So I would make sure that you've got clarity between what your supplier's capabilities are, and think about industry guidance, such as in the CDC guidance.
Yeah, I agree. And one final thing that I don't think I've said, because there's a lot on this slide though, but again, as often as you can. Disposable sharps container. Maybe you're on a reusable sharps program for the rest of your hospital. You don't want a reusable container in that patient care area or that room where that Cat A patient will be. So just there's lots to consider. And also think about, again, I talked about this a little earlier, other waste streams that might be generated, pharmaceutical waste, different chemical waste. But again, the answer sometimes is, don't even bring it in the room if you don't have to. Don't bring the whole bottle of Tylenol in that room. Sorry, clinicians, that's probably a bad example, but not a clinician. But don't bring that whole bottle in. Just bring the one pill so you don't have to throw the rest of that bottle away. So.
All right, so we talked about special permits before. What you're not going to find clearly defined in the regulations is how to package category A waste, and that is going to be defined in special permits. For example, the requirements for packaging Ebola and Marburg waste, those are going to be identified in special permit 16279, and that includes 4 different items. You'll see here PG2 compliant waste barrels. Before we go farther, probably should clarify what that means. What is PG2?
Yeah, it just indicates how dangerous that material is. 1 is the greatest level of danger, 2 and 3 are a little bit less. Now you might be like, whoa, Kara and Alex just said Cat A is like the worst of the worst. Well, they're allowing for PG2 packaging, kind of that middle ground, because there's so much other stuff going in that container or that drum as prescribed in this permit. Lots of bags, disinfectant. So yeah, that's PG2 though is a specific type of drum that and it's easy to find.
Packaging.
It's good too. So type of packaging, excuse me. Go ahead, Alex.
So another thing to keep in mind here is if you have a patient under investigation, if you take that waste and you put it into the packaging intended for category A, you have now contaminated it potentially unnecessarily. So having a plan for your patient under investigation waste for storage collection until it's confirmed is really important, because your medical waste supplier, if you're sending your waste offsite for treatment, may not be able to take it in your packaging that's intended for category A. So just make sure that you verify your supplier's operational capabilities with them before you undertake certain packaging requirements. I think, Kara, we're ready to turn it over to Caroline.
Wonderful. Thank you, Alex and Kara. And oh my gosh, thanks for sharing all of that information. I know for me, that was incredibly helpful to detail all of the different nuances of waste management. So thank you for that. Over the next few slides, Jill and I are just going to really recap what we learned from Alex and Kara and apply it to the healthcare facility and really share how to handle waste management for special pathogens with care. And then friendly reminder, we will have a question and answer session at the end, so please add your questions to the Q&A box on Zoom. So to recap, we'll review the following items: definitions and terminology, Cat A pathogens, healthcare facility and agency planning, in addition to handling and packaging, sequestering, education, and training. So let's start with definitions, next slides. I think what Alex and Kara did was really just emphasize that there's a lot of different definitions out there. And what we talked about in particular was category A waste management. Special pathogens is a term we use to define patients who require additional safety measures to ensure safe patient care and to maintain safe care for our safe health and keep our healthcare workers safe. And then select agents are a very well-defined term from the CDC and USDA that categorize anything that might pose a threat to the public, animal, or plant health. Next slide, please. And I'm going to hand it over to Jill to talk a little bit about terminology and just, again, reinforce what Alex and Kara shared with us today. Jill, over to you.
Thanks, Caroline. So we're going to be super quick about this because we do want to get some questions. But we heard a lot about special permit. So the special permit is required to move category A waste. A vendor requests the permit from the DOT, and it has to be requested for a specific pathogen. So for instance, there isn't just a blank special permit for every special pathogen in one lump together. So right now, the only special permit that's out there is one for, luckily, Ebola and Marburg. And that's because there's been an ongoing threat of both of those pathogens for the last year and a half or so. That's special permit 16279. And to date, 12 vendors from across the country have applied for what's called party status. Like I said, one vendor submits the request for a special permit, and then other vendors can apply by demonstrating to DOT that they have the means to dispose of this waste, and they can sign on to party status. And with this link on the slide, which will be provided, you can check and see which vendors have party status. So one of the other things that we talked about, you heard a lot about regulated medical waste, red bag waste. Those are typically for us in the healthcare setting. That's what we're talking about. We're talking about red bag waste, the portion of the healthcare waste stream that might be contaminated with blood and body fluids. And for us, it's a lot of like saturated dressings. It might be blood products, things like the bags after a transfusion and things like that. If you're able to inactivate waste on site through something like the use of an incinerator or an autoclave, once that waste is incinerated, it is no longer category A. So even if you start out with category A waste and you have a validated waste cycle, it's no longer category A. So there isn't such a thing as inactivated category A waste. Those two things don't go together. And then several people have asked about sequestering waste. And what we mean by that is to safely, securely hold that waste pending the outcome of diagnostic testing. And that's super important because you don't want to waste the money and the effort of sending off waste that turns out to have malaria, which is not a category A pathogen. Caroline, you want to talk a little bit about these infectious agents?
Absolutely, Jill. Thanks. So just bringing home the information we learned from Kara and Alex, they did highlight there's a long list of infectious agents for human pathogens, and some are considered infectious agents for waste management in culture form only, that C-O that they highlighted. And you can see the bolded items on the right hand that might be considered, or that are considered infectious agents for waste management in culture form only. Highly recommend working with your lab team who have developed these day-to-day procedures for managing culture form only pathogens that require handling in a different way. They have a lot of information on those processes and those steps, and of course are great partners to collaborate to learn more. So as Jill mentioned, space is really important to consider, particularly as we see we're getting a lot of questions about sequestering. So when we think about space and managing waste in a healthcare facility, we've really categorized them to two sections, to assess and treat and to sequester waste. So we might not know if this patient has a special pathogen, but we're suspecting. So how do we sequester waste and where can we put it securely while we're confirming whether this patient has a special pathogen? And then also when we assess and treat, do we have a space that's identified for a suspect patient? Do we have a pre-identified negative pressure room if possible? If not, do we have a room that might be isolated or, not heavily used that we could place that patient in? What about the distance and route from the point of entry? Is there visibility to the area? Is there AV support? Do we have a phone in there? And then is there an ability to remove extra equipment and supplies? And What about upholstered or non-wipeable surfaces? Try to remove all of those if we do have a suspect patient, just so then we know that the cleanup and potential disposal, if that patient is confirmed with a special pathogen, all of that will have to be discarded and thrown away. So I'm going to hand it back to Jill to talk about all the different types of waste for healthcare facility considerations. Jill, back to you.
Yeah, so I think one of the things that Kara and Alex did a really great job of highlighting is that not everything that's in that room is going to be something you want to throw away or could throw away. So really thinking about, all right, here I am in an ED or in any other patient care setting. All right, I've got this patient, I've got a stretcher, I've got linens, I've got all these supplies in the room. What am I going to do? So anything that's potentially contaminated by that pathogen needs to be thought of as whether it's cleanable, right? Cleaning and disinfecting, or whether it's going to end up to be waste. So patient care debris, our discarded PPE, any of the unused disposable supplies we might have taken in there. Generally speaking, linens are going to fall into the category of waste in this for these patients, the things that have been in that room. Of course, dedicating a sharps box or making sure at least that your staff can even take a sharps box off the wall. In a lot of places, you might have an outside service that does that. That's really important that we make sure that sharps box is handled differently than the rest. And then things like medications and IV fluids, because many of us have very stringent guidelines about what we can put into trash versus what has to be disposed of in another way because it might have medications in it. So you want to make sure that you can inspect and clean the things that are wipeable and cleanable. If you have hard surfaces, if you have durable medical equipment that is capable of being cleaned and disinfected, then certainly that's the first line of defense here. And you really want to partner with your infection prevention professionals to give guidance on that. And there are EPA-approved disinfectant wipes, for instance, on the Q list from Marburg, that will help you pick a disinfectant that's appropriate to use, for instance, on your bed or stretcher. If you had a mattress that was used in the case of an Ebola or a Marburg patient and wasn't intact, and we've all dealt with that, right? You thought the mattress was intact, and then you move the patient and there's a hole in it or a tear or a rip. That's when you really need to reach out to your waste vendor and to the DOT PHMSA to talk about what you're going to do and how you're going to dispose of that mattress. Because things that are larger than can fit in a barrel need special handling, and that's going to need a lot of planning and preparation. You're also going to make sure that this is a confirmed patient before you start throwing any of this stuff away. All right, you probably already have processes in place to deal with red bag waste. So thinking about using those same processes for the waste that might be a category A waste. So a secure closure device. You might want to add a solidifier or something else to absorb liquids, whether that's a Chucks or an underpad or maybe a solidifying powder you add to a waste or an emesis bag. You want to double bag at the source, whether that's in your EMS truck, in the patient care room, or in your laboratory. And then make sure that your staff are using great PPE techniques and hand hygiene. So you might want to do a glove change as you do a different layer or when you go to double bag, changing your gloves in between. And make sure your staff are aware that they're going to be lifting these bags up. And so you don't want to overfill them, thinking about both the volume and the weight of those bags. So I'm going to really just skip this slide for the sake of time today, but know that there are barrel codes and directions for how to read these barrel codes for making sure that the barrels you have are compliant. So you want to prepare the drums. If you have drums that are provided by your waste hauler or you have the PG2 compliant drums, they need to be prepared in a clean area. We're talking about where you're going to sequester your waste or where it's going to be handed off to your waste vendor. Absorbent material goes in the bottom of the drum, and then there are 2 liner bags. Again, compliant with those ASTM requirements into that barrel. We're going to put that double bagged waste into that prepared barrel. Now you might use some other mechanism to roll it through your facility, like a regular waste barrel that you can clean and disinfect later. But the bagged waste can go inside these liner bags. When that barrel's full, you're going to close that first liner bag, disinfect the top, close the second liner bag, disinfect the top, and then put on the lid or head to that drum or barrel. And that's usually got some sort of locking mechanism. And then you're going to disinfect the whole outside of that barrel. That then can be labeled and sequestered and wait for your vendor. All right, lots of people that need training. We're not going to have time to go through all this today, but think about what training you can provide for your bedside caregivers, things about room selection and waste handling, PPE, especially your environmental services staff, who will be cleaning the room or this handling the waste, your lab staff, and your EMS partners, what you can and can't receive from EMS. So right now, there's some flexibility in the guidance about what facilities can receive, and certainly waste that's generated in the care of a patient in transport, that facility may choose to receive that waste from an EMS partner. So right now, we're going to try to get to a few questions. So I'm going to have Jade come on camera as well, and we're going to go through a couple that I know have gotten submitted today, and we'll try to get as many as we can in here. So I'm going to turn it over. Who wants to answer the first question here? We have a couple about the suspect cases. Yep. So a suspect case or a person under investigation. When you might be waiting several days for diagnostic testing to come back. Whether you still have that patient or not will depend on where you are and what your relationship is and what's going on with the weather even sometimes, right? Whether you can move the patient or not. But thinking about the waste that'll be generated, you want to plan a place where you can safely and securely store that. That can be in a storage room, it can be in a place that your waste vendor might supply, but it needs to be secured, it needs to be safe away from pests. In some states, they require temperature control, and you want to make sure that someone can't inadvertently access that, right? So this is away from the rest of your waste in a place that can be safely held. And you want to minimize anybody having to repackage that waste. So if you already have it packaged as category A waste and it goes out as category A waste, fine. If you have it packaged as category A waste and now it doesn't have to, you're probably going to have to remove it from those category A waste barrels and make sure that that's being done in a safe manner. So having that waste already double bagged and making sure that that's leak proof will help you ensure the safety of your staff. What else do we want to answer today? I know we had some questions about Marburg, and there is a current Marburg outbreak going on. Marburg waste is covered by that current special permit, and it is pretty lethal pathogen. So this is certainly something that ranks up in the same category as Ebola, and which is in the same viral family.
There's also a good one, Pox, Jill. When you're trying to figure out, well, which clade is it, right? And, and it can take, that testing can take a really long time, of course, too. There was guidance, and I can't remember, I apologize if it's current though, when the outbreak was happening, because they were like, DOT was like, there's such a low possibility of it being clade 1. We're going to assume it's all clade 2 and all that waste, and that the cultures can be managed, as category B, regulated medical waste. Yep. But remember, again, it's only the cultures of clade 1 that is category A. So
yep. So all of the regular Mpox waste, whether that's linens or isolation gowns, dressing materials, you need to be careful with that. Mpox does have some persistence in the environment, but that doesn't mean that it's category A. So that can all be considered your regular waste that can go into if it's contaminated with blood and body fluids, then it should be in with a red bag, but not category A waste. And then just use appropriate disinfection techniques.
Jill, just one thing that I'd like to call out, because I've gotten a number of questions on this. If an organization, sometimes organizations will choose to classify their waste above the way it is defined. And if an organization chooses to class something as category A when there's no testing verification for it, that does not mean that someone will be able to take that. So there would need to be a special permit issued. So just make sure that you're in contact with your state and Department of Health and your supplier, et cetera, before making such a determination if there's not a verified case.
Absolutely. And it's really important to understand that as healthcare facilities, we are waste offerers and we are obligated to correctly categorize and safely and securely package waste for the safety of our communities and our waste vendors. So this really does have, the responsibility is not all on our vendors. It's largely on the healthcare facility to make sure we know what we're handling. I know that there were several questions about autoclaving and validation of waste cycles. So, Jade, I don't know if you want to jump in with an answer here, but this is something that's sort of undefined still. What exactly qualifies as a validated waste cycle?
Yes, and just to touch on that briefly, if there is on-site inactivation, one of the best ways to understand what happens afterwards and what documentation and stringency of that validation cycle is working with your waste vendors, because they're the ones receiving that. So they may guide in terms of like, we'll need biological indicators, how frequently are we testing, what are we testing, and the robustness of that. So there isn't clear guidance at a larger or higher level in terms of what how we're defining validation of those cycles. But Jill and I are going to be pushing that rock up the hill as far as we can.
That's right. That's right. So I know we're out of time today. We have a lot of questions. We were actually anticipating that we would have a lot of questions, and I want to let you all know that we are working hard on deciding what our next webinar should be about category A waste, because we know there's going to have to be more information sharing. There's so many questions and so many variations on this that we really know that we need to put together in the next webinar quickly. I want to thank our guests today, Kara and Alex from the Healthcare Waste Institute. And please, this is a perfect opportunity. Partner with your infection preventionist, partner with your EVS and your waste vendor, and really figure out what your plan is going to be, because the only way to really get through this is planning. So thank you to our NETEC guests, Jade and Caroline. Thank you for the folks behind the scenes. Thank you so much, and have a great day.